Thank you so much, Ambassador Shannon, and it is now my pleasure to introduce the Honorable Eliot Engel, who has represented New York as member of the U.S. Congress since 1989. I got a little dyslexia there, 1989. He's got a lot of experience. He's the ranking member of the House Foreign Affairs Committee and also serves on the Energy and Commerce Committee, including the Subcommittee on Health and Subcommittee on Energy and Power. Representative Engel is founder and co-chair of the House Oil and National Security Caucus and a member of the Gun Violence Prevention Task Force, the Bipartisan Task Force for Combating Anti-Semitism, the HIV, AIDS causes, among others, and he needs 100 years to do all that. Prior to his election to Congress, Engel served for 12 years in the New York State Assembly. Welcome, Representative Engel.
Don't I look great for someone who's 120 years old? Well, thank you very much, Maria Elena. Thank you for those kind words. Michael Shifter, thank you for your leadership of the Inter-American Dialogue. Carla Hill, Tom Shannon, thanks to both of you for being you. And I want to thank everyone here this morning. I always look forward to seeing so many familiar faces at the dialogue, and I'm grateful for all your work. It's no exaggeration to say that your work is more important than ever before. When I was first elected chairman of the Western Hemisphere Subcommittee of the House Foreign Affairs Committee back in 2004 and came to know many of you, I was really blown away by the wonderful work and important work that you do. So thank you for continuing to do it. Thank you for continuing to focus Congress on some of the things that are just so important. One of the legacies of the Obama years will surely be the invigoration of U.S. leadership in the hemisphere. We knew right away this was a priority for President Obama because I remember traveling with him to his first Summit of the Americas in Trinidad and Tobago. Shortly into his first term, he laid out a vision of an equal partnership with simple engagement based on mutual respect and common interests and shared values. And 8 years later, I'm gratified that he and Vice President Biden have pursued that vision with great results. I hope this continues into the new administration. A few areas of progress are particularly important to me. In Colombia, steadfast U.S. support has aided peace negotiations. My good friend, President Santos, who is here this evening, deserves the lion's share of the credit, but I'm also proud of that the United States could play such a supporting role. I think the relationship between the United States and Colombia through the years has been very important. I've said this to Ambassador Pinzon many times, and I treasure the relationship we have with Colombia. In Argentina, President Obama seized on the opportunity of President Macri's election and has worked diligently to breathe new life into our long, dormant bilateral relationship. In Central America, we're now addressing the root causes of child migration by investing violence and poverty reduction programs. And finally, U.S.-Mexico relations are stronger than ever. I know we can all agree that when it comes to our neighbors to the south, we must build bridges and not walls. Otherwise, we risk undoing so much of what we've accomplished. Not long ago, our relationship was marked by suspicion and mistrust, and we cannot go back to those times. Fear and divisiveness have no place in our foreign policy, and I want to tell you as ranking member of the Foreign Affairs Committee, I will work tirelessly on both sides of the aisle to keep the United States on the right course when it comes to the Americas. And so that brings me to two key areas of unfinished business for the new administration and Congress. First, we must prioritize working with our neighbors in the Caribbean. That is why I introduced legislation calling for a new multi-year strategy for Caribbean engagement and have espoused establishing embassies in 5 Eastern Caribbean countries where we have none. Cuba has it, China has it, we don't have it. So we need to focus on energy, citizen security, and economic cooperation. The House passed this bill in June, and I hope the Senate will act. and send it to the President's desk by the end of the year. And secondly, I believe the U.S. government needs to reevaluate our drug policy in the Americas. We need to take an honest look at what's worked, what's failed, as we continue and consider how to spend our counter-narcotics dollars going forward. With heroin use on the rise in the United States, our children deserve no less than a fair evaluation of our drug policy. Now let me turn to the business at hand. It's my honor to present the Inter-American Dialogue's Distinguished Leadership Award for Social Equity to Dr. Vanessa van der Linden for her instrumental role in fighting the Zika virus. As of November 2nd, Zika has been found in 73 countries and territories, most of which are in the Western Hemisphere. We've all become familiar with the dangers this disease poses, namely the devastating birth defect that has affected children born to infected mothers. Last August, working as a pediatric neurologist in Recife, Brazil, Dr. van der Linden noticed a sudden uptick in cases of people getting sick. While cases typically showed up every couple months, out of nowhere she saw dozens of infants with this once rare condition. Dr. van der Linden noted another oddity. A large proportion of these infants' mothers experienced unexplained rashes during their pregnancies, a telltale symptom of the Zika virus, which had been circulating in Brazil just months earlier. She made the connection and she shared her observation with public health authorities, setting in motion the critical research, response, and prevention that's helping to combat this virus. Without Dr. van der Linden's vigilance and swift action, there is no telling how long it would have taken to discover the link between Zika and the illness, or for that matter, if the link would have been discovered at all. This knowledge has allowed countless women around the world to take steps to avoid Zika, have healthy pregnancies, and make informed decisions for their families. So we commend Dr. van der Linden for her discovery and also for the remarkable compassion she has shown her patients. Earlier this year, Nadia Gomez Becerra, whose daughter Alice was treated by Dr. van der Linden, told the Wall Street Journal, and I quote, "Many physicians who looked at Alice did not even know how to take care of this, not Dr. Vanessa. Dr. Vanessa is so special that she even gave us her cell phone to talk to her whenever you need." Lately, it felt like we're running a bit short on acts of kindness, on remembering that we need to trust each other with decency, to appreciate our common humanity and our shared struggles. So hearing these stories, seeing what a difference one person can make in the lives of others is truly uplifting. So please, everyone, join me in congratulating Dr. van der Linden. Would she come up, please, to accept her award? Come over here. You gotta hold it.
Good evening, and thank you all. Thank you for the kind introduction. I'm here representing all the professionals from my state that since the October of 2015 have been trying to somehow to alleviate this tragedy. Between September and October of 2015, we identified in our state a significant increase of congenital microcephaly, with typical findings of congenital infection. And from the beginning, we know that it was a new disease. In November of 2015, the Brazilian Ministry of Health declared the accepted relationship between the increase in occurrence of microcephaly and Zika infection. And in February of 2016, the World Health Organization declared an emergency of international concern. At this moment, there are more than 2,000 confirmed cases of microcephaly related with congenital infection in Brazil. In my state, around 400 cases in Pernambuco. I work in a rehabilitation center that now is reference for patients with congenital Zika syndrome. And at this moment, we are following 200 patients. I already work with other severe neurological disease. For me, the main challenge at that time is the number of the patients severely affected at the same time. This disease came to show how vulnerable we are, and at the same time, show that we need to be aware and to a new factor. The epicenter of this tragedy happened in a poor region of my country, my city, my area, and we still have many questions with no answer. I'm proud to the work we have been doing in our state, the first identification, notification, and the correlation between the fact and the symptoms, which lead to a presumption and later on the definition of the causative factor. This agility was crucial to alert and to, at the same time, try to prevent the occurrence in other cities, states, or country. In this context, we have contributed somehow. Actually, we still don't have any notion of the real proportion of this tragedy. What we already know are the consequences of the more severe form of the disease. When the symptoms appear in the first year of life, maybe these cases are only the top of the iceberg. Prospective study in pregnant humans with the Zika virus infection humans with confirmed infection of Zika will try to elucidate better the spectrum of the disease, which can range from asymptomatic patients to severe affected child. The investment in research is so important in order to understand, identify the natural history of this disease and minimize the consequence of it, as well as prevention and take care of infants who had already been affected. The challenges of life are what motivate us and make us grow and improve. I want to thank this institution, the Interdialogue, for all the recognition of our work. Thanks to the team of professionals, friends, and researchers from Pernambuco, my state. Nobody does anything alone. And the work we have doing is only possible because of this great group of experts who are seeking the same objective. I would also include two important people to medicine and to my life, my mother and my brother, who are also a pediatric neurologist like me, and they work with me. I want to thank the government of my state for believing in us, especially in the beginning, and giving all the support as much as possible, since we are suffering from a crisis, the health system in our state. In addition, and it's extremely important, I would like to give a special thanks to our patients and their families, who are the reason of all of this work and whom we are learning with every day, because life is it, a continuous partnership. Thank you very much.